We are back here on the Lynne Freeland Show. This is our first go around with doing a Zoom conversation on the Lynne Freeland Show, but we had to do it because the conversation was that important, and B, there's so many different perspectives. I'm not going to introduce everyone all again. I'm going to get straight to the conversation. And DeWitt, Walton City County Council, I want to start with you here because one of my concerns is this whole pandemic situation that we found ourselves in has really now focused attention on disparities across the board. I'm thinking about our school systems. All of a sudden, everyone now realizes this digital divide is real between inner city and suburban. How do we all knew it existed, but now the rest of the world knows it exists. How do we continue to keep pounding this home that we can't continue like this?
Well, I think Reverend Burgess and Councilman Lavelle in the earlier segment talked about legislation that has been passed in the city to establish racism as a public health crisis in the city. On Tuesday, a motion of council will be introduced to try to mirror in many ways what has been done in the city. It will be introduced and referred to committee, where we will sit down and try to work our way through and draft a document that can ultimately generate support by 8 votes and ultimately address those issues that you outlined. Because again, education, employment, health disparities, all of those issues that are really there and causes stress on our system has to be dealt with on a countywide basis. Mm-hmm. And this gives us, this motion of council gives us the foundation, will give us the foundation to try to address, to tackle all of those issues up to and including issues that we've been trying to deal with before, like the Independent Police Review Board. So it just gives us a basis to move an agenda forward, to tackle all of those issues that that highlight the inequities in folks in Allegheny County based on race and income. So the work continues.
So then, Ed, let me bring this to you. So then what I'm hearing from all of you is that we can take this bad situation and use this as momentum.
I always tell people, sometimes our darkest days brings the greatest challenge and the greatest reward. And I think you see that on a couple of different levels with this COVID-19 virus. For one, to see elected officials work with our public health experts who do health every day, I think that's a bonus. For us to be on the Lynne Freeland Show tonight, discussing the partnership to ensure that African-American neighborhoods get the proper testing they need demonstrates the power of unity when we come together. So I think that's first. Secondly, I think it shows the community that we care. We have to continue to do that. So working through our federally qualified healthcare system, it makes sense. That's who the community trusts. That's where they go. And so we need to work through them to ensure that we're doing that. And secondly, to talk about a task force that discusses the disparity between Black and white and being able to do the things that's necessary to decrease that disparity. So today is a good day. I mean, even though this COVID virus is something that we can't play with and we need to follow the science of it, the reality is it's brought a sense of unity that we didn't have before this. Mm-hmm. And when you see people working from different sectors to ensure that the community's well-being is taken care of, that's the challenge we accept. That's the challenge we want, because we know in the end that makes a difference. So the key right now is to get testing in our neighborhoods so that we can understand whether before, during, or after COVID, we know where our community's at. And that's what we're focused on working on to ensure that our communities remain healthy.
So now let me circle back around to Dr. Conti, because, we're talking about testing, we're talking about this momentum, but there are some other challenges within our community. And let's be real, you know, there's some folks out here that don't want to deal with social distancing. They don't want to deal with masks. They want to get their hair done. They want to get their nails done. They just want to get out. And now the weather's getting nicer. And we've got to be real about some issues in our community. We got to be candid about these conversations.
No, for sure. And as you see more things start to open up, that's when we really have to be focused on keeping our community safe and reiterating the issues of social distancing and making sure that we are wearing masks, because the more people go out, the more potential exposure, because there are so many asymptomatic people that can carry this virus. And because we don't have the testing for all those asymptomatic people, we have no idea of who we're coming into contact with that may have given you an exposure. So this is the time that we continue to remain focused and continue to work with our community partners to ensure that we are, one, educating the community about this virus, and two, trying to get more testing, especially as new testing modules come out, like the antibody test.
And in fact, we're going to take a commercial break. When we come back, I want to talk about testing, and I want to talk about economics, because the realities are, we know we've got to get some money into our community because we too have suffered through this. We'll talk about all that next when the Lynne Hayes Freeland Show continues, so don't go away.